Hi, my name is Dr.Jou. I'm an oriental medicine practitioner working in South Korea. I have been working with many difficult diseases for more than 30 years, so I am sure we have been very successful in making our clients feel much better by natural medical protocols. We are just focusing on how to improve the health of our patients with oriental and natural methods, so we usually offer the natural medical therapies for our patients. And now let me talk a little about the angina pathology. The angina is quite a common disease across the world, so many people now have enough information about what it is like to have the angina. Many people is now suffering from the disease, and many people, even though they have got the medical treatment from the conventional medical practices, some people still have difficulties breathing, chest pain, and other difficulties. They have to be through a lot of very difficult situations as they do their everyday activities. So we are like to it is likely that natural medical protocols and natural medical therapies will help them very much when they work with us appropriately and diligently. Now I'm sure that many people is very much familiar with the pathology or the pathophysiology of the disease, and many people has now enough information about the angina. So we like to just skip over the pathology of the disease, and we just like to find out a solution as to how to remove the root causes of the disease. Having said this, I just like to mention that the root causes of the disease is quite different from the pathology of the disease. The pathology of the angina pectoris is quite well known, not only to the average process, but also to medical practitioners as well, and many people, that the blockage of the coronary arteries, and as a result, the ischemic myocardial muscles may be the result of the blockages of the arteries. So this is the pathology of the disease. So the conventional medical practice usually focus on how to remove the blockage of the arteries and how to make the blood flow thoroughly through the coronary arteries. So a stent implementation, as you know well, or bypass surgery or prescription drugs are quite common medical procedures that is needed to get better. However, we just like to mention that root causes of the disease is quite different from the pathology of the disease in terms of the angina pectoris. The pathology of the disease simply means that there is some blocks, there is some root blocks in the coronary arteries. However, the root causes of the disease is much different from the pathology of the disease. The root causes of the disease has been within the patient's body for a long period of time without representing any symptoms or any difficulties, perhaps more than 10 or 20 years. Even though there is the root causes of the disease, including the cholesterol buildup or toxicities of the heavy metals in the coronary arteries, it does not necessarily cause any symptoms to occur, because the root causes may be with the patients for a long period of time without the patients feel any much changes in his body conditions or feel any symptoms of the disease. However, when we take a look at the root causes of the disease, we can say that when we are able to remove the root causes of the disease, then we can reverse the symptoms and the disease itself very perfectly, and this will be the ideal and optimal and most desirable medical therapies that the patients can receive. We are sure that some patients who have gone through the medical procedures still have some difficulties associated with angina. We just like to suggest that the Eastern medical therapies as well as natural medical therapies can help them very much, because the natural medical therapies can help remove the root causes of the disease. Removing the root causes of the disease is quite different from removing the pathology of the disease, and we need to differentiate one from the other, and this is the core and essence of our natural medical protocols. in order to remove the root causes of the disease, we have to approach the problem or disease from a different perspective or different viewpoint. This is quite essential. And in order to do that, we need to understand the disease by the perspective of the Eastern natural medical conceptions or the natural medical conceptions, which is quite popular in Western society, because the natural medical conceptions gives us very precise and very different viewpoints, which is quite different from that of the conventional medical practice. So we can understand the root causes or fundamental or underlying causes of the disease much more efficiently, and then we can set up some plans, some natural therapies, some nutritional plans for our patients much better. Now let me introduce how to approach the problem from natural point of view. Now let me introduce how to approach the angina pectoris with natural point of view. Now let me introduce one of my patients. His age is over 60, and he's a man, and he has come to my office because he had been diagnosed as a patient with angina, but he had been very much scary of the medical procedures because he was recommended to go through the medical procedures, and one of the most serious procedures, the bypass surgery. As you know well, the bypass surgery is so scary that almost all the patients who had been recommended to do the bypass surgery would not like to go through it actually. Now, as I said, I like to approach the problem from a very different perspective of the root causes of the disease, and in order to do that, we have to understand the energy flow of our bodies. As you know, well, there are many types of energies in our bodies, and in the Chinese medicine, this is called qi, and in the Indian medicine, this is the Ayurveda medicine, this is called prana or energy or etheric energy, are the words which has been made to point out the same identical conception. They are almost identical in their meanings. Now let me introduce this diagnostic image. This diagnostic image is made up by us, and this exactly represents how what type of body shape the patient has. This is the navel, and this is the body or trunk of our patient's body. This is quite simple, but we need to say that by some subtle interpretation, by some subtle analysis of this abdominal diagnostic image, we can determine that the patient has a stronger yang energy. This means that the patient has a little or less energy or forces of yin energy. So yang energy is very much dominant in the patient body, and we need to balance the energy forces of yang energy and yin energy, and this is vital conceptions that we need to use in order to make the patients feel better. And at the same time, the energy, as you know well, covers all the body performances, all the body functions of our bodies, and this indicates imbalances on the whole body, So on the whole body, the patient have some imbalances of energy flows and energy balances, so we need to correct them as a measure to correct the root causes and remove the root causes of the angina pectoris. Now let me show you another example of energy interpretation. Well, this is the hair mineral test, and when we take a look at the hair mineral test values, this is the normal value, and this is the allowed values. When we take a look at this level, we can see that this level is much higher than normal. This level, what do you think this level is? This level represents the manganese values when there is the over toxicities. This means that the toxicities of the manganese is quite present in the patient's body. So manganese as a toxin can play a very important role in causing the disease, because the manganese have something to do with the internal walls of the coronary arteries in a very subtle ways. And many people and many medical practitioners is not familiar with this conception that the manganese have something to do with the development of the pathology of the coronary arteries. But they are. They exactly in the toxicities of the manganese is exactly at the core and essence of the pathology that is described by the medical practitioners in the world. So I would like to say that removing the toxicities of the manganese is a vitally important tools and measures for us to use in order to make our patients feel better, and we have done so exactly as is exactly after 1 year of period of treatments. The patient feel almost completely free from any type of symptoms and any type of pathologies of the disease. The patient said to me, well, everything is just perfect. Well, I'm sure that this is a very good outcomes or results of our clinical practice, and the efficiencies of the natural protocols is much better than the outcomes that can be achieved by the conventional medical practices. So we need to understand that there are different type of root causes of the disease that causes the pathology to be present, and then if we're able to remove the root causes of the disease, in this case the imbalances of the energy or forces in the patient's body is the root causes, and at the same time, as I said, the toxicities of the manganese is also at the core of the root causes of the disease. So by removing these fundamental causes of the disease, we have been able to make the patient feel much better, almost free from the symptoms, and the patient said to me, everything is perfectly fine, perfectly better. So we we are sure the natural medical protocols will make the patients with angina pectoris in a much better conditions. So I am sure that there are many people who still have some problems, even though they have got the medical procedures by conventional medicine. So we like them to come to our office as a complementary measure to get better by the perspective of the natural medical protocols. Thank you very much.